Hello there and happy Tuesday. My name is Julie Hirschberg. I'm a neurologic physical therapist and the owner and founder of Reactive Therapy and Wellness here in the Los Angeles area. And very excited. Oh, hey, Olivia just joined. Nice to see you. Very excited to chat with you about some new literature that I have to thank one of my colleagues and a person that I have really learned some of the most from. He's on Twitter and Instagram as FMD Portal, actually posted about this article and I got so excited. I was like, I've got to talk about this article. So let me share it with you here. This, let me look at the date on it exactly. Just came out in 2022, Functional Movement Disorders and Deep Brain Stimulation, a multi-center study. I was just looking, actually it came in 2023. So very recent, hot off the press, as usual, what I love to talk about, what's hot off the press. And this was fascinating to me. It was published in the Movement Disorders Clinical Practice Journal, a peer-reviewed journal. And it's a multi-center, like huge, big movement disorder programs, publishing data, looking at the emergence of functional movement disorders after deep brain stimulation surgery. And this was deep brain stimulation surgery for Parkinson's, very common, dystonia, both cervical dystonia or generalized dystonia, essential tremor, and cerebral palsy. All different reasons that I've seen deep brain stimulation performed. So this was not deep brain stimulation for functional movement disorders. That is not a thing. It's very risky surgery. But this was the emergence of functional movement disorders after deep brain stimulation surgery. Something that really caught my eye here, because we do know that functional movement disorders are more common in folks with a disorder like Parkinson's or dystonia. And so it just really makes you wonder and ponder and get curious about the mechanism. What is it about the brain connections in those disorders that might kind of predispose somebody to also have a functional movement disorder? So let me give you some of the details here. First, I want to show you one of the tables from this study. This is it here. I don't know if you can read it. Let me pull it up in the study as well so I can give you all the pieces. These are the key clinics that they did a retrospective study, by the way. So this was retrospectively looking at their data. Cincinnati, in Denver, in Gainesville, Florida, in the Netherlands, in Spain, and in Canada. They looked over a period of many years. It was almost 15 years for some of the clinics, 15 or 16 years. And they looked at their total number of DBS cases. So that's what you see in that column. You can see, for example, in Florida, they had 1,122 DBS cases. And you can also see Gainesville, Florida, again, did about 70 cases per year. So they had the most experience with this. What they found retrospectively, again, they weren't going out to look at this prospectively, so there's some limitations there. Retrospectively is that they found out of all of these procedures and looking at what occurred in the year afterwards, these were the number of cases of functional movement disorders that occurred. And you can see there's actually a different prevalence at each of the sites. So, for example, the highest prevalence was in Netherlands. They had 2% of cases. In Colorado, 1.3% of cases. So one of the biggest things is like, that's less than one case per year. So this is not a common occurrence. So that was not the purpose of the study to go, oh my gosh, look out for this as a complication from DBS. It's not very common. But I think for me as a therapist, for our team who sees a lot of people with Parkinson's and sees people post DBS, and we can see some really interesting things after DBS, it really made me wonder, gosh, I actually wonder if some of the things that I have seen were actually a functional movement disorder. So very interesting. So I want to share, here, I'll stop sharing this table. I want to share a couple of things from this study that really stood out to me. So first of all, so over the course of these like 15 or so years in these different movement disorders clinics, there really were only 29 cases of functional movement disorders that occurred after deep brain stimulation. Most of them were in people with Parkinson's. So 22 were in people with Parkinson's. 4 were in people with cervical dystonia who had DBS. And 3 were in other types of dystonia, so generalized dystonia. And 1 generalized dystonia or dystonia with cerebral palsy. None of the cases occurred in people with essential tremor. I think that's interesting. Also, this was also really interesting. It was less than half of them were female. And we know that functional movement disorders tends to be more common in females. So that was interesting, right? And the other thing is that for a couple of the cases, I'm looking for the exact number, they actually may have had three cases. They may have actually had functional movement disorder prior to the DBS, and then that worsened after the deep brain stimulation surgery. So also really interesting. Now, overall, a pretty small sample size, only 29 people. So it's hard to make some really big conclusions out of that because that's a small group. You really need, ideally, a prospective study that looked at multiple centers and looked for this prospectively over time to really be able to pick this up. But I wanted to talk about what these functional movement disorders look like, and then just to think and ponder the why, because I think this really, it could tell us something, right? And so that's what's most interesting. So first of all, what kind of functional symptoms did people have after surgery? The most common was tremor. So that's also the most common functional movement disorder is tremor, followed by dystonia, followed by ballism. So sudden jerky movements, bradykinesia, functional bradykinesia, so like a functional Parkinsonism, myoclonus, chorea, and then tremor with dystonia. So these were the type of functional movement disorders that emerged after deep brain stimulation. Now, let's ponder a little bit of the why. So this is more of the discussion part. That's kind of the results of the study. Very, very interesting that a functional movement disorder would occur after deep brain stimulation. Why? Why would that occur? And honestly, when I saw this, I was like, well, that's not really surprising. When you're going in for deep brain stimulation, you are changing the connectivity in the brain. And a functional movement disorder is a connectivity issue in the brain. It's a real biologic issue in the brain. I know that goes against some of what medical professionals believe about functional neurologic disorders, but it's an actual connectivity issue. We know and understand that there are different parts of the brain that are implicated in some of those connections. So temporal parietal junction is one, supplementary motor area, the amygdala. There's several areas that have been shown repeatedly with functional MRI imaging to be implicated. Those are not the areas that are stimulated typically in deep brain stimulation. And in fact, in this study, let me pull this up too, the most common DBS target was the STN. And that's really common. in DBS, and GPI, globus pallidus internus, is the second most common. Those areas have not been implicated in functional movement disorders. But again, we know that those brain areas are not isolated. They are heavily interconnected with other brain areas. And that's actually what we know about Parkinson's and dystonia, are that it's actually some of the parts of the circuit that are interconnected with the basal ganglia that are so important to some of the manifestations that we see. So could it be that by doing something like deep brain stimulation, you alter the connectivity in the brain and a functional movement disorder emerges? That is quite possible. What else is possible? Could it be that undergoing a physically traumatic event like deep brain stimulation, that's a pretty big surgery? I have definitely seen that that people with neurologic disorders post-surgery can have changes in their symptoms. And this is true. We see this in MS, we see it in Parkinson's, we see it in stroke. Anytime you're altering the brain with anesthesia and surgery, you can have changes in your symptoms. So could the physical and neurologic trauma itself of the surgery also be contributing to an emergence of functional movement disorder? Maybe so. Maybe so. Maybe a lot of these folks actually had functional movement disorder. We see it in Parkinson's. We see it in dystonia. Absolutely. We can see it in cerebral palsy. Maybe they had it, but their other symptoms were kind of overshadowing it. The symptoms that the reason they were getting the DBS. So maybe a really severe tremor or dystonia, for example. Then when the DBS, after DBS surgery that addresses those symptoms from their CP, from their dystonia, from their Parkinson's, so maybe those symptoms get better, and actually unmasks that they had functional movement disorder symptoms all along. Because we know and understand now that functional movement disorder can coexist with neurologic disorders. And it actually kind of makes sense that it does, because there are changes in connections between key areas in the brain with neurologic disorders. So it makes sense that those neurologic disorders could actually predispose, maybe be a precipitating factor for functional movement disorder. We don't know, right? We don't know for sure why these functional movement disorders might have occurred after deep brain stimulation, but they did. No, it's not very common. So this is not like I'm concerned for people who are having DBS and they have Parkinson's and that this is a big risk factor. No, it's not actually. It's not very common. But as a therapist, and this is what I would really highly recommend for other therapists, this should be part of your screen. This should be part of your screen for every neurologic disorder, is to look for the presence of functional movement disorder or functional neurologic symptoms as well. By the way, the authors of this study also note this happens in seizures too. People can get functional seizures after successful surgery, brain surgery, to address the seizure, the epileptic seizure. So this is not an isolated issue, and I think it speaks so strongly to the true biologic connection issue that is going on in the brain with functional neurologic disorders. Now, I get so passionate about this because there's a lot of misinformation about FMD, that it's purely psychological, that it's a psychiatric issue, that only people with childhood trauma get it. No, that is actually absolutely not the case. Now, is there a potential subtype of FMD that might be trauma related? Possibly. But that's a subtype that we've got a huge group of people with FMD that is not the case. And there's a lot of misinformation about that. And in fact, it leads to FMD not getting accurately diagnosed because people throw it in this dustbin of like, well, I don't know what it is, or I think it's psychological. It's not. It's an actual disorder, actual connectivity issue. And I think actually this study supports that this is a brain biologic issue that occurs. And it occurs more often in people who have other neurologic disorders as well. So I think that's really important to note. And it's one of the reasons that because there's such misinformation about this, that I am sharing about FMD a lot. I'm really passionate about it. I'm really passionate about proper assessment and treatment for my fellow healthcare professionals. And I just want to, we do all of these videos and we share all of this to spread the word. I wanted to remind you, if you're a healthcare provider, Brittany Kim, my fellow PT here and phenomenal ortho neuro PT, created this guide, 10 things ortho PT should avoid when working with somebody with FMD. Avoid these things because it makes it worse. And it has some really great tips that you can use right away. And also, and it's free because we care to educate our fellow healthcare providers so that you too can help people and also help them get better faster. So this is in this download. Brittany created this guide. It's fabulous, 10 easy things. But then we also include one of my favorite articles on the optimal theory of motor learning and control, because this is a key part of treatment, as well as the consensus articles for physical therapists. My dog has something to say about that. So all of this is included when you download this, and you can get it at reactiveeducation.com. And it's right there on the front page. You can download it. This is a free resource for our fellow healthcare providers. And even if you're not a healthcare provider, you can download this and share it with a healthcare provider. I don't care how you use it. Just help us get the word out, because we really feel so strongly about advocacy for functional neurologic disorders. Now, if you're not already on our email list, I'll send out a link to this article, the videos, all the great resources that we have. If you're a healthcare provider, join at reactiveeducation.com. If you are a person with a neurologic disorder, caregiver, friend, any of those things, join at reactivept.com. We'll put this in the newsletter this week, and I've got so much to share this week. So keep your eyes open. I will keep sharing. Thanks so much for joining me tonight, and have a good night.